Hello everyone, welcome to this session and this is Meet the Topper session. We have our first topper who we will be interviewing, Dr. Isha, and I'm proud to say that Isha is a junior from my residency college, that is from Tata Memorial Hospital. Welcome to the Conceptual Anesthesia platform, Isha.
Thank you so much. Thank you.
And heartiest congratulations on achieving two greatest milestones of your life. One
Mhm.
is she's got the INI CET Super Speciality Entrance Rank 1 in critical care, and she's joined AIMS for critical care.
Yeah.
And the second is she just recently got married. So we
Yeah.
congratulate Isha on both the milestones
Thank,
and achieving both of them so perfectly in the same year.
thank you so much. Yeah.
Okay. So Isha, we
Yeah,
want
with great
uh,
difficulty. Yeah.
with great difficulty for the marriage or for the INI CET exam.
Both.
Okay, so a little bit of a background about Isha. She has done her MBBS from Medicity in Hyderabad, and after that, she has done her residency from Tata Memorial Hospital in Mumbai. And currently, in the April INI CET SS exam for critical care, she was the topper, and she's already started her critical care DM right now. And first of all, we want to know from you, Isha, that when did you decide that you want to do critical care? Because, when people enter anesthesia, they enter not knowing what are the various branches that are available as super specialty later. And then by the time they reach third year, they see, okay, we've not had enough ICU exposure. We are not sure whether we want to do ICU or not. So, what was your take on it? Had you decided from first year itself that you want to do intensive care, or did you decide over a period of time, and how?
So to start with, like anesthesia, I was initially when I had taken it, it was always like a stepping stone for me to do critical care itself. Even anesthesia, like for my PG residency also, I had to like I knew what I didn't want to do. I didn't know what I wanted to do. So out of exclusion, I had come to anesthesia, and through that, I had realized that I wanted to do something in emergency medicine, critical care. So I had initially thought of that, and I had taken even Tata also was thought of in that way itself. कि मुझको critical care I want to plan for in the future, and that is why I had taken Tata. But during the course of anesthesia, like I had fallen in love with the subject so much. It has like taken me so much of difficulty to even leave the subject and be like, okay, I want to do critical care. Because during the course of my time, like I actually fell in love with the subject. It actually made me want to read so much more versus what people generally think about anesthesia. I say. So yeah, that was the thought process. It was always critical care, but in the middle, I did think of like, should I go for a path where I'm doing just general anesthesia and stuff like that. But I came back to critical care itself. I was like, okay, no, this is what I want to do. So my preparation also was the same way. Like I had started all from the beginning itself. Like when I joined in first year, we already had ICU postings in like I think a second or third month itself. We would get posted in recovery and stuff. So since then itself, I've had like a wanting to do critical care. We've been like always surrounded by seniors who are really amazing at their job in Tata. So there have always been people who like give us the respect and the knowledge that even though you're a first year, also they take you seriously and be like, okay, you want to do critical care, so they would really initiate us to do things and want us to like study where can we read from. They would divide the ICU patients also into like this is your number of patients, you are completely going to take care of this, the case presentation, treatment, everything, give us a plan. So from then onwards itself, it had become like a part that I really wanted to do critical care. But in first year, I did not read as much. Like towards the end of first year, I had started because I got my like actual ICU postings by the end of first year. That also like basics itself. I would read Paul Marino, and I had started Washington from second year essay because the rest of the time, like getting accustomed to what is happening in anesthesia only was necessary at that point. In second year, again, because of COVID, we had a lot of postings in ICU. So that kind of was a blessing in disguise for me. So all of my dyselectrolemias, ACLS, BLS, everything I got to like practice during second year itself. So all of those things, anyways, they overlap with anesthesia. So it didn't really matter. Those things I had learned all through second year. And then third year, I had completely left off critical care because I had to pass in anesthesia. I went back to anesthesia, read like what are core topics in anesthesia. But there was so much overlap all the time that like I didn't really have that difficulty. Even now when I'm working, like I know like my skill set at least I'm little like confident about, even though my medicine might be shaky. Like I know that, patient I can say for like at least this point. Now the diagnosis, treatment and all, I'm learning as I go. That's what's happening. Yeah.
Okay. So can you list out the books that you use for your preparation and the books that that definitely these have to be done and there will be questions for this from for the exam from these books.
Yeah, so I had read, like I said, Paul Marino for sure, Washington's 100%. Then I had read there are like these books that are available for ECG as well as ABG,
Hampton's ECG.
X-rays. Yeah,
Yeah.
those tiny books, like those handbooks. Yeah, so those I would use for just revision and stuff like that. Then for fluids, I read from Miller's itself because Miller's is extensive right now. Like it has everything, including importance of glycocalycyl, sab kuch it's included already. So fluids I had read from Miller's, which is very like extensive, good enough for like critical care also. Then further on, like I said, a lot of overlap was there. So anyways, वो सब हमारे defibrillation, ACLS, BLS, anyways came in our anesthesia this thing. During my SR ship, which was anyways a compulsion for us because it's a part of the bond, that during that time I had read like very core critical care topics. So that time Washington again I had to pick up for sure. By that time Paul Marino became too basic of a book. But then I had to read like core topics that would be for sure asked in critical care. So septic shock guidelines I would open, ARDS guidelines I'd open. Mechanical ventilation anyways we had read during anesthesia itself. I had read Chang's for mechanical ventilation. Then our Tata ka ARC ka book also, matlab, by the time third year end ho gaya, we had read so much of it. So
So many
ECG,
times.
X-rays, everything is included in that. Airway difficulties, IDA guidelines, the DAC, DAS, sab kuch like anyways had importance in critical care as well. Dyselectrolemias also I read from Miller's only. Like that, like I was able to differentiate. What I realized, what I didn't know was infectious diseases, burns, poisonings, OBS emergencies. These were things that we actually did not face also as much. So I had to learn separately. So I would Google like one study that would like be cited the most, and I'd just read that. Because the thing is, like, I had passed my MD exam in August, and then I wrote the INI SS in November. So there wasn't much time in the middle for me to read extra things. So these only like whatever was like landmark trials, I would ask my seniors and all. There's this ICU trials app on this thing on our Android and iPhone also. So that I had opened, and whatever would come up on that, those I would learn for sure. So the first time I had gotten in ESS in November, like I qualified and I did the interview as well. But the thing is, in interview, I did not score as much because I wasn't prepared as well. So they had like a proper like 5 consultants. Each one of them is asking three questions each, like a proper viva it was. So that I wasn't prepared for. They were asking very like specific ICU questions, USG related to ICU, eco and things. So now after that, when I tried the second time for NESS, then I had read there are some additional books that are there like thematics, which is like hemodynamic monitoring. One book is there. Then in that itself, our eco, TEE, everything is included in that. That book I had additionally read. And I had used some online platforms as well, which were giving like studies that are related. So I realized like in the interview, they were asking a lot of evidence-based medicine. Like they wanted us to quote like this new study has come. So fluids may what would you use to do for a septic shock patient in ICU. So it was not very textbook based anymore. So I had to read new papers. So I would find that online itself and then read them up. Again, like I had seniors both in Tata and like one of our senior from Tata had also been in AIMS. So I asked him also like what was relevant right now that is, important new studies that are come, what are people really trying. Those I would read up, and I think for the second time the interview was much better.
Okay.
Yeah.
Did you
Mm.
specifically go back to read some source for medicine part? Because everyone who is from the anesthesia background gets very scared. How will we solve medicine
Yeah.
questions? We've completely, not
Mm.
touched base on that at all.
Yeah.
So,
Yeah.
did you specifically go back, or like you said, some topics like OBS, infections,
Mm.
antimicrobials, all
So
this?
infections, I couldn't go back. I didn't have time to read. So still, it is like a lacuna for me right now. I had read, like, my initial plan was to attempt NEET exam only. I was not planning on INI. INI was just like, abhi, like, as a part of preparation, let us try essay wala. So when I was planning for NEET exam, so we had to read medicine for sure. It is like a general medicine based exam itself.
Hmm.
So I had read CVS and RS because anesthetist, so easy रहता है करके वहां से start किया था, so that, like, I'll get in the flow. So that I read from Harrison, CVS and RS, and I read like a little bit of nephro, also Harrison, just the boxes mainly, because everyone says that, like, they're all one-liner questions that come in NEET, and most of them are the boxes that come. So those are like, pakka ratta marufai them. I found that CVS and RS were pretty, like, we already knew most of it. Maybe some new things like pulmonary fibrosis, ऐसे कुछ that we are not very, like, used to studying. Those I had to read additionally, but newer things, like, now I'll have to read more. ऐसे ही है. Medicine wise, like I said, still not very confident. But as days go on, I'm reading again from like scratch even now. Mm.
Okay. So for INI, you basically suggest that whatever are the latest trials, whatever
Yeah,
are the latest publications, those are something that need to be covered for sure.
yeah, yeah,
It's of course you need to do your basic
yeah.
of those topics as well, but this
Mm.
is the ranking questions that will help you get an edge
True,
over others. Yeah.
true.
Can you give us an overview a little bit about your interview sessions in both November as well as in April, and what were the kind of questions asked? Are there any resources to prepare for it?
Yeah, so like most of the interviews start with your kind of background, where you're working from and all. So the consultants themselves get an idea as to what could be like things that you're very good at and what you wouldn't be good at.
Right.
So the first interview in November, that's what happened with me as well. They had asked, like, I told them that I'm from Tata, and like we have an oncological patient population over there. So the initial consultants would ask things like tumor lysis syndrome, that I would be able to answer, things
Right.
that I knew I could. Then they would go into something very deep, like a Vexis score for RICO and all, which at that time I had no idea about.
Mhm.
So those things I couldn't answer. So a lot of USG based, they always ask things that actually you would use in the ICU. They didn't want anything that was, by hearted, because they themselves also not interested. It's not something that we would use. The
Practice.
thing with like the theory part, like, is very core critical care. There's 80 questions, and there's 60 questions that are critical care, 20 that are anesthesia.
Hmm.
Those anesthesia questions also, they're not basic anesthesia. They're mostly like, they try very difficult ones, like pediatric anesthesia. Like, if you're using an intubating LMA, in that, which tube would have gone for a pediatric patient who would, like, something really complicated of that sort. And the critical care part would be very core critical care. Like, for sure, you'll have 5, 6 questions on ARDS, 4, 5 questions on ECMO, some USG questions for like volume of distribution formula pe koi question. Like, those things that are like expected will be there for sure. Septic shock, Q SOFA, these are like expected. Those theory mein aayenge hi. Like, actually qualifying for the theory is pretty simple.
Hmm.
The problem is with the interview itself. So in November, that was what happened with me, wherein like I was not really prepared. So a lot of USG based things they asked, and a lot of studies, which again I didn't read. So there were like newer trials where they were using steroids in early community acquired pneumonia. All these things I didn't know of at all. And it was very overwhelming actually. Like, they were like, "Do you know the answer or no?" And I just immediately blurted, "I don't know." And then they were like, "Okay, bas chalo, ho gaya." Haan. So it was pretty scary at that time for me. Now, because I already went through the this thing interview the second time, I was like, okay, now I know like they're going to be scary. So I kind of like thickened my skin. The second time, I was like, okay. They were asking pretty simple questions by then, like fluid resuscitation and septic shock. And then if you know that basic answer, then they would go into the studies for the second time. Yeah, ARDS, and then they'll be like, what are the newer modes of ventilation? Then like pericardial tamponade or pericardial effusion, what eco findings will you find? They wanted like like what would you find in pericard this thing pulmonary embolism eco findings, SSF. They were asking like short answers. They just want like question answer question answer. Isko aata hai 3 questions mein, they'll give their marks and they'll add up everything and that will become your rank. It's like that. They don't really have too much of a to and fro at that point. Aise.
And it's more of the practical part of it.
Yeah,
It's not
definitely,
something that
definitely.
you are using in day-to-day life, not
Yes, yes,
something that will be
definitely.
written in some book and asked from some corner.
Yeah, definitely. It's not at all like literally what you would do in the ICU would be asked for the interview. Even the theory also, it is not very difficult to crack, but it's just that you need to be prepared. I say, like people have some kind, like people who are already in the critical care realm, they find the anesthesia part difficult. Someone who's already done anesthesia just now and freshly started critical care has not seen patients of that sort. Like for me, ECMO was something that I don't know. They were asking questions in theory for like troubleshooting of ECMO. I have not even put ECMO for a patient. So these I had to go to like some random videos on YouTube, find out like oh which cannula are they using, how are they doing this. So this because I wrote the exam twice, I realized okay, these are the type of questions that they're going to ask. And there's a lot of repetition. Like I said, burns, snake bite, poisoning. These are like topics that will definitely come in theory. So you
Hmm.
should read them as a beta blocker, K poisonings, calcium
Hmm.
channel blocker poisoning. All these actually come in aims. That's why they're asking also. So
Okay.
you have to face these things in real life. So they want to know it. Organophosphorus poisoning, for like all of those do come. So all these only will be there in the theory also. And once the theory gets over, the practical, the preparation is a little different. That's the thing.
Hmm.
This is like very book based and questions that we know of, like the topics I say. But the interview is little overwhelming like that.
Can you
Hmm.
give us a breakup of the theory exam, as in how many questions come from critical care core and how many
Yeah. So
anesthesia?
60 plus 20. Anesthesia is 20 marks almost. Like, I mean, it doesn't, I mean, they don't stick to it mostly, but I say 20 to sometimes even 25 questions also come. There are
Okay.
lots of questions that will be like, ketamine kiss mein contraindicated है. Some things like, that are very simple like
Yeah.
that also will be there for sure. They'll give you like our alveolar gas equation ka formula to like,
Hmm.
calculate. There were, like I said, ECMO and ARDS, septic shock, Q. So far, a lot of questions come from that. Almost 20 questions वहाँ से ही रहेंगे ऐसे. This is like the base of critical care, so they want to know. Some like AKI के criteria questions will be there. UGI bleeds. These
Hmm.
kind of things that are like expected from us, they will ask for sure. ऐसे. So the critical care part, like I said, like if you are going to read the books that I've mentioned, usme this much gets covered anyways. So
Yeah.
it's not going to be like difficult because you're an anesthetist, ki you won't know this. Even someone who doesn't have critical care experience also will
Hmm.
be able to answer like a huge chunk of it. The anesthesia part also is like something, if you're just pure, like just now passed and all, it will be really fresh in your head now. Like sizes of pediatric LMA and like ETO, they definitely are there.
Yeah.
They'll ask about like how the tough years line changes for a pediatric patient versus adult patient.
Okay.
How does like regional anesthesia change for a pediatric patient? A lot of peds questions they ask because they expect that people won't know. A lot of blocks also came. QLB had come for us, which I don't know what is the use in a critical care this thing exam, but they had asked these questions as well. So it's very like I found it easier than the NEET exam because NEET was very like medicine based. So I found it very overwhelming that way. But INI is like made for an anesthetist only, someone who has like a proper perioperative physician who
Hmm.
knows like how to treat a patient in the recovery ICU, OT mein kya hoga, all those kind of things. Easily they'll be able to
Definitely
crack the
more
exam.
practical stuff.
They're all practical stuff, yeah. There's no like things that they want you to by heart and come and answer, nothing of that sort. Even the options also that they give is not like they're purposely trying to confuse you, nothing like that. They'll all be 4 different options. You have to really think and be like, yeah, this is the correct answer, but there's no like complications in it at all. Mm.
Okay. So, as a critical care physician who's been working now for 5 months at one of India's best centers, would you say it really makes a difference if you are from an anesthesia background or from a medicine or chest medicine background when you're practicing intensive care? Because a lot of people who enter anesthesia have this bias in their mind that I will probably not be a good intensivist. But as you mentioned in the beginning, your skills definitely will be much better. Your intubation lines,
Mm.
monitoring, all that will be much better than people from medicine background, with no
Mm.
offense.
Mm. It's
But
true,
we do it day
definitely.
in and day out in the OT.
Mm.
So, what do you think practicing as an intensivist, does it matter what is your background, or it just matters what you learn at that moment once you enter ICU and from there on?
No, truthfully saying that insecurity is like it does remain. Even I also feel it every single day that I go. But like it does like function as something to, provide that passion to read more. I
Hmm.
mean, at this age, after reading so much, you're like, और थोड़ा पढ़ना पड़ेगा क्या? But the thing is that this patient care requires it. So you will want to read for sure. It makes it very interesting. Like I said, your patient is not in harm's way. You are definitely going to see to it that the patient is fine. That much skill we have 100%. We have done a lot of OT. We've done like really good cases where we don't need to like be underconfident about that. It's like the fine tuning of skills.
Hmm.
You want to see to it that now that this patient has come to you as an intensivist, you give them the best chance possible. Then you have to read. That's the thing. So now even I'm also doing the same thing. Like I still have to go back to reading like my basics all together. I had done that in anesthesia as well. Like I had to go back and read Gait and respiratory physiology. Like our consultants were of that sort who were like your foundation has to be strong. So the same thing like applies now also for me. So if I have to read something which involves like all this crazy evidence-based medicine, मुझको basic आना ही पड़ेगा. So then I do go back and read. So it's okay. I mean, it is a struggle for sure, but it will fuel the fire. You will continue to study for sure. It's not going to be like because you are going to be in this physician's position, you're going to harm the patient in any way. The skill set is definitely a huge advantage, like a huge advantage. It's like there are doctors who don't know कि ET tube पे black line भी होता है. Okay, so like that is how the world is running right now, and you are there
Yeah.
like as your cool anesthetist wala background, you can do anything. The
Yeah.
pediatric के IVs, they think there's big things like you're in the ED and you're intubating a patient who's 150 kgs with no difficulty because you know how to go about this,
You'll
you know this
manage.
thing. So
Yeah.
you don't need to worry. Now the rest of it, exacerbation, COPD will take care of it. Like what acute, it's just like problem you can solve for sure. Later on, definitely you will be able to. So I mean, it's not something to be like, underconfident about. But yeah, that does remain. Even I also do have, I won't lie, that I'm like super confident I can do anything ऐसे. But पढ़ाई तो करना पड़ेगा ऐसा है. That I'm still doing for my sake also.
So there are certain things that you are better at than your
Yeah.
medicine and chest
Yeah,
medicine
yeah.
counterparts, and there are certain
Definitely.
things where we do need to catch up, like maybe antimicrobials and basic
Definitely,
like
definitely.
emergency medicine sort of things which
Mm,
we've not done
mm,
over 3 years.
yeah, yeah, yeah.
Now, going back to preparation for the competitive exams, since you've also given NEET SS critical care, can you tell me how would the preparation for NEET SS crit care be different as compared to for INI CET?
Like
Like
I said, it's
add
really
more to
different.
these books.
They're very different actually. General medicine is like the base core for NEET exam. So like you'll have to go through the whole again, like your Harrison. You must have notes to begin with. It might take some time, but the thing is, like all the medicine people write one exam, and all like in that itself, you are the ones who are going to choose critical care. Like the other ones will be writing for some other exams like neuro, cardio, and all. So you have a good shot for sure. A lot of my colleagues have done really well in NEET exams as well. So it's not that it's not possible. They'll get DRNB or MD based on whatever their ranks are going to be. But the preparation is difficult. And different also from like what I felt for sure. Now, because I had written NEET like in 1 month of passing MD, I literally didn't prepare for NEET. So I wouldn't take my advice on NEET preparation for sure. Like INI, after I had written this thing like 2 3 months of my MD, I had prepared for. So that theory part I could at least like cover in that first exam, and the second exam I could plan for the this thing interview. So I got that kind of difference. And now we have anesthesia questions, so then you have some amount of like a special edge towards it. Like okay, 20 questions तो minimum मुझको आ ही जाएंगे. In that core critical care, at least like 25% you'll already know. So you're already like all close to the qualifying mark that will be there for the theory. So it kind of provides some amount of confidence that way. But NEET, I didn't write like properly prepared, so I really can't give my
Hmm.
best advice on that. Yeah.
Okay. How do you feel like a female in intensive care? Is it
Actually, I was really scared
nerve-wracking?
about this. I love having girls around me because I find them very responsible versus guys, which I know is very sexist, but I mean, I've always made really good girlfriends and all. So I was worried about it for sure, but I'm surrounded by lots of girls actually. It's doesn't feel like, that it is like male driven field, at least for now. And lots of seniors who are like girls who are really helpful. My colleagues are really sweet. They're like three girls out of five, in my semester that is there. Lots of girls. So I don't think right now there's a difficulty. Also, like every time I've seen our consultants also win like really powerful women, in Tata as well as in AIMS. So, and it's never been something that is shaken us. I don't think that's ever going to be a difficulty for us. Yeah.
And also, is the workload manageable, or is it a lot during residency and then later?
It's a lot. Actually, it's a lot. It's especially if you're, newly joined to a place where you don't know what things are happening. Take some time to orient. Also, here in AIMS, they like keep posting you in new places. So by the time you get used to one place, you have a new posting in a new place. So that gets a little difficult. But it's like our general critical care shifts only. Everyone goes through it. So the workload is the same. I mean, it's difficult. I say you cannot really complain.
So, with that, I would like to end this interview with a parting advice from you for people who want to prepare for critical care INI SS. So, what would you suggest for someone who's just entered anesthesia now to start reading from first year, second year, third year, and then finally?
Yeah, for someone who's just joined, like enjoy anesthesia first of all. Like don't make a decision against anesthesia. It's not supposed to be like an adjustment for medicine. It's an amazing branch. It's like it's made me want to read actually. So I would definitely tell you to think about it. Go through OT, enjoy each and every intubation, spinal that you give, because those memories you'll never get back. It's amazing, especially in that age, that whole adrenaline rush that you get for the smallest things. Enjoy it. As time goes on and you get experiences with your OT and your ICU, like genuinely think about yourself in the position of your seniors. Can you see yourself doing shift works? Can you see yourself giving this much time out of your life for this specific thing? Not that anesthesia doesn't require time. It's just a different type of difficulty. So is this my favorite difficulty versus another difficulty? It's just that. So see yourself in that position for sure. And for preparation, definitely like start early on. It'll always help in anesthesia. Like all of these things, like always come in handy. Even your exams also, if you're thinking like, oh, is this going to be helpful? It definitely will come, like, be of help. For your every day practice as well, it's going to be helpful. So it'll always help you to increase the quality of your work. So by like maybe second year beginning, maybe come up with a plan as to maybe, yeah, this is what I want to do. Read them additionally, whatever I have already discussed. All those things could always help. And enjoy your ICU postings, learn from each patient specifically, always ask doubts. Think of yourself as a part of the team. Don't be the junior that does only sampling, or the junior who just thinks "He mujhko kya aata hai," because you
Paper
can give
writing.
so much of, yeah, you can give so much of like what is that input from your side with that fresh young brain that you have, versus us being old and tired. Like someone who is interested, you can actually rub off your interest on your seniors as well. So
Mhm.
always be like on your feet, try really hard. Like it's not something that's difficult like for us to achieve. So definitely plan ahead, if that's something that you want to do. And yeah, it's obviously possible. If I'm doing it, everybody can do it, no problem.
That
Yeah.
is a very humble way of ending it. But thank you so much for joining us, Isha, and we wish you all the best for the
Thank you
rest
so
of your
much, ma'am.
residency as well as your future.
Thank you, thank
And
you.
I would like to add that we are starting discussion of critical care MCQs from this month on the Conceptual Anesthesia app, and that is going to be done by Dr. Saurabh Taneja, who is an intensivist at Gangaram Hospital. So, for all of you who are aspiring to join critical care, this would be very useful to you all. And if you all have any more doubts for Isha, you all can leave it in the comments. We'll make sure to reply it. And thank you so much for joining us, Isha, today.
Thank you so much, ma'am. Thank you.
Take care. Bye.
Bye bye.